Bien,
Good morning, everybody. Can everybody hear me?
veo que se siguen
I see that
ingresando los
people are still
invitados.
joining
Vi algunas manos
us.
levantadas.
I
¿Es
also saw
porque
some
están
raised
haciendo
hand.
pruebas
I
de que se
think
ven bien?
probably it's because they want to know if they can listen as
Ok,
well.
perfecto.
Awesome, fantastic,
Eh,
great.
Vamos a empezar ya en
We
un
will now
minuto
start in
nuestra
1 minute
reunión. Muchas
our
gracias.
meeting today. Thank you very much.
Ok. Buenos días con todos, bienvenidos y
Good morning,
bienvenidas.
everybody, and welcome everybody for this virtual seminar in honor of the Memorial of the Road Safety Day.
Antes de comenzar con la
Before
sesión,
starting the
recordarles
session,
que tenemos
I'd like
una
to
interpretación
inform you that we'll have simultaneous
simultánea. Ustedes
interpretation
pueden encontrar
available. You will be able to
en
find
su
it
plano una
below
imagen que
an
parece un
image that
símbolo.
looks like a globe.
Pueden darle
There
clic
you'll
y
click
elegir
and
el
also
idioma
choose
para
the
que puedan
language, the
escuchar
pair language that you would like to listen
nuestra interpretación.
for the simultaneous interpretation of our live event.
Comenzando, bienvenidas a
Starting,
todos a esta sesión.
first, welcome
Tenemos
everybody.
una
I'd
calidad de
like to
invitados
give
demasiado
a warm
especial
welcome in
esta ocasión,
representing
que junto con la Asociación
WHO together
Iberoamericana
with the
de
Ibero-American
Referencia
with
y el
VICVI organization and
Vicepresidente de
also
la
the
Junta
chapter of the Latin American of the Alliance,
Global de
Global
ONGs.
Alliance of NGOs for Road Safety.
Estamos realizando
We
este
are
evento.
performing this
En
webinar
este
today.
evento vamos a abordar
In this event, we'll try to
abiertamente
address the
el
crucial
tema de
event
la
of
presencia de
strengthening the
migrantes en la región de las
response
Américas.
for the Americas,
Compartiremos diversas
and also we'll
perspectivas
present different
acerca de
points
la
of view and
atención de
perspective
víctimas
to focus on
y
the
los
attention for the
beneficios de
victims and also the implemented
nuestros
initiatives
países
in
como
the
objetivo
upcoming
fortalecer
country
su
to
sistema de
strengthen
salud
their
y
health
atención
systems and
médica.
also provide
Para
support.
dar inicio
To
a
start,
nuestra
we first we will
presentación, voy a
to start our
compartir
presentation, I'll start
el
sharing
video con las
the
palabras
video
obtenidas de
with the
nuestro
warm welcome and word
director,
from our director,
que es
Janice,
director de nuestro
that he is
departamento
our director of
de
our
enfermedades no
um,
transmisibles y salud mental.
non-transmitter and mental
Dame
health
un
disease
segundito
department.
para
Give me one
cargar
second so that I
el
can share
video.
the screen, the video.
Aquí les tengo las palabras de bienvenida
I
del
have the
doctor.
video here from the welcome words.
Les la más cálida bienvenida a este seminario virtual
As the
organizado
greatest virtual workshop in the World Health Day on the remember of all the victims, where we will share the important topic about strengthening the response post-sinister in the regions of the Americas as an important axis on addressing systems and also promoted by OMS and also OPS. All the injuries caused by, well, road safety is it's a problem for health. We believe that 50 million people will suffer big and important lessons that are caused and most of the time have demanding consequences for the states of each other country. That is why the organization of from OPS together with the organization together from um, road safety issues, focusing on the chapter of Latin America and also the Global Alliance of NGOs for the road safety. We are currently working with to promote trans systems, safety system that could prevent violence that are causing big harm and provide an adequate support and opportunity to all damage affected victims. In this event, we will discuss all of the situations that we have analyzed from different points of view with the end goal to support this uh, solution in the Americas. We will also examine all the initiatives that have been promoted in different countries of the region to strengthen their health systems and also guarantee a level of quality of support for all the victims that together with them we will be able to support and follow up with a universal agenda. This is particularly important if we consider that this year in the World Assembly for the Health approved a systematic support with everybody in the preparation of the attendance and also the care of all the youth and sanitary support, and at the same time the protection, a constant protection for support in the areas, recognizing the fact of the important role that the civil society has and is performing to promote and back up and provide more effective policies, and at the same time, based on the evidence, this virtual workshop will be an excellent space to incorporate the voice of SSTA and at the same time the Global Alliance that constitute a important platform that's aiming to promote and build synergies on different fountains of the areas. The NGOs can also become promoters and an independent voice to contribute in the social challenges. That is why we need to bring spaces to promote their active participation in the decision-making part in places. We want to invite everybody to share their experience and at the same time include their procedures with everybody involved in this area. Our commitment is to build significantly together with all the established goals between the countries in the General Assembly from the UN on the action plan promoted for road safety and also inside the agenda of the sustainable development with the end goal to increase the quality of service and benefit and reduce the number of deaths and disabilities related to transit. Thank you for your dedication and let's continue working. Perfect. Thank you very much. We also have the warm welcoming words from Dr. Now, jumping to our first block We have here different local authorities represented from leader organizations about road safety that are going to share their reflections about the opportunity to strengthen the response in the Americas. As his first speaker, we have Dr. Ricardo Perez Nuño, advisor in road safety and prevention of non-intentional damages. Go ahead with your presentation, Mr. Ricardo. Thank you very much. First of all, I'd like to start appreciating your reflection with an important group and colleagues interested about the importance about post-sinister. Also speak and talk a little bit about the job that we have to focus on the attention of the emergency and at the same time identify opportunities of synergy and also collaborative assistance support between everybody. First, I'd like to focus on the priority area and addressing and integrated safe system areas that can also help us to remove the mortality rates caused by the transit in all of the areas that together with information from 2019 were projected and shared in this dotted line in blue, explaining that by 2025, we are not going on the road to reach the goal that we have established, that in this graph we have established in yellow with the yellow line. It will be basically the same, expecting a different result. Of course, this is not an option anymore for all of us. Even though we can all agree that it's important that we all want to prevent any lesions, it's important to consider that when they come, an emergency attention adequate and opportune will contribute significantly to save life and also increase the capacity. That is why it's an integrated support when we're trying to address a safe transit promoted by OPS and also promoted by management. It is estimated that 1/3 of the deaths on a world scale could be easily avoided if the countries from low income could have similar results from the countries of high incomes. That is why the support and emergency, we consider that this shouldn't be a forgotten topic in the agendas on road safety. At the same time, focus on the emergency. This has the potential to contribute in different health services committed in the sustainable development support. And this is an intervention that indeed is cost effective for the implementation of different governments. That is why the World Plan Expand published previously from the World Health Organization in this previous documents that I'm sharing right now will include a series of recommendations to support the post-crash assistance, strengthening the emergency attention. The sanitary institution have committed to support the emergency aspects through this sites of resolution that we have included in the context of the Health Assembly, where since basically more than 20 years ago, in this year, like we mentioned before by Dr. Hennis, we promoted this resolution for the integration of the ecological and the care for the sanitary support and also the protection on sanitary emergencies that was evidenced clearly by the COVID-19 pandemic. At the same time, on October 16 last month, the countries published by the Assembly that's explaining on a high level support about the sanitary unitary coverage, where in on the number 55, they committed themselves to intensify efforts to assist the integrated systems and emergency care. This resolution at the same time has given the mandate to OPS and WHO to promote these countries with this. And that is why we've been working together, evaluating the different emergency attention in 5 different countries of the region, 4 of them in the last year. We have been supporting and working together with some countries to perform this exercise. All of this diagnostic helps us identify gaps that through corrective attentions and also priority areas, they can also contribute in the emergency area and support. These 3 levels of the organization, we have been coordinating together very efficiently to support the sanitary and the health ministries of all of this country. A very important gap is in the training of the health services and the standardization of the emergencies areas, together with the support from WHO in the emergency Latin American emergency group, La Flame, and an important group of professionals committed to this topic. We have promoted this year together with the leadership from the OPS office in 4 countries, the implementation of the strategy in the course of basic attention that was developed by OMS, the International Federation of the Red Cross, and also the International Federation of Medicine. The 6 courses that we had, where we had the opportunities to support this year, were certified up to 165 members, and we prepared 160 facilitate to replicate these workshops in this context. The last workshop was in Costa Rica a couple weeks ago, and was the first one that was performed together with local instructors from Leans and also the rural box from Costa Rica, and also promoting the consolidation of this strategy in the country. As a matter of fact, in this country, we recently had the formalization of this work, this training for the recertification of the medical staff. I think it's a great step to perform this workshop and also strengthening the capacities of all of these professionals. In Paraguay, the health ministry declared this workshop an institutional interest that constitutes a big accomplishment in a strategy support. This definitely gets a lot of support considering the fact that Dr. De Galgadillo will explain their point of view in this webinar. This work hasn't been left aside as a result of this commitment that we have discussed in this country, that we're discussing this important aspect. The UN Fund for they promoted a finance that we can continue working together with other countries as well. We could also include other efforts to move on from this topic. With this, I'd like to thank the rest of the colleagues with the countries that we have been able to work on their leadership, and also the big commitment, inviting the rest of the countries that they can add to this important work, knowing and identifying that, please, you can count with us, and together we clearly can move on, and of course, keep growing. To support the work in our countries, we launch in May this publication thanks to our collaboration center and the University of California in San Francisco, that's aiming to support strengthening the emergencies care. And at the same time, I'm honored to communicate that we are launching this other publication on the right, thanks to the enormous support from Dr. Ruben Ledesma and Dr. Lucon, are trying to keep track of different experience of different countries that have moved on the implementation of road safety, explaining that that we can move on from the topic, and at the same time together we can save lives. Finally, highlight that in the upcoming December, the health organization will be publishing the global report about road safety, and will support regional areas together with the areas that will help us allow how we have managed in the different sections, and especially what are the biggest challenges, updated challenge present currently that we need to address together in these emergency areas that we've been working. At the same time, of course, considering the fact that with this, we are honoring together the painful loss of a numerous of people, that with this, we are paying a good tribute that's aiming for to support the families in the areas that are suffering the consequences of these strategies, that one way or another, they can be avoided. And when this happen, we can also avoid the death and a disability with a correct attention. And with this, I want to thank everybody for this space. And we are aware of, we are here happy and with our arms open to support the rest of the countries. Thank you very much. Thank you very much, Ricardo, for your wonderful presentation. Now, we will now give the word to Pablo Martinez Carniano. He's the director of the road safety in Argentina. Good morning, everybody. Thank you very much for this wonderful invitation for participating in this wonderful event, and at the same time, briefly share how we have had our Argentinian experience linked with the attention of the post crash for the victims. All of us, but we are here, we know perfectly that a crash definitely can change forever the life of the victims and also their families. That is why the states has the goal, the duty of being there available to explain the process when this type of characteristics are happening. This could be more easy and smooth for the people that are suffering pain. And also, aside from the pain, and also aside from this that can join us and be with us for the rest of our life, a collision triggers a lot of necessities that are concrete and they need to be addressed. And we are going to talk about, when, let's say, for example, let's say a country like Argentina or other countries with with internal migration, when a collision happens in a point of the country and there's a death, and it's necessary to transfer the body to where that person was living. That cost a lot of money, and we all know and we're aware that all of the problems are affected strongly by the humble people, the poor people. So we from the state are trying to provide a response for this type of support and assistance. What happens, for example, when unfortunately there hasn't been a death or someone that needs to go to the hospital in one point of view, very far from their point of origin, and their family members need to go to their place to accompany them on the recuperation and assist them to be with them in that moment of time. We, from the network, we try to facilitate the tickets and the food and also the care of their family members as well. Let's all imagine that any collision with death or disability will start a judicial process. No one is ready for this, and luckily, this is not common that someone needs to find themselves with a judge or with a police unit. And let's imagine, like I always say, if it's a person of low income, a person or a family that don't have many elements to perform, that's why we accompany them in all the judicial process. That's why on the situation, the psychological situation that's done when a family member dies. Let's imagine a mother that she needs to communicate to her other siblings that their dad died, their daughters, who has gone to a psychologist when they truly need to fight every single day for their basic subsistency. Psychologist or the psychoanalyst, at the end of the day, they are service for the medium class or high class. We try to support the poor to receive, and I can name a lot of service providers like rehabilitation process, the long time that a family or a person they need to rehabilitate themselves, they need surgery and therapy, a prosthesis, and they can't, or the same health system is not providing it, or they don't have coverage. They need someone that needs to assist them. You currently have the situation, the complicated situation when a person is suffering, probably they'll be there for a while without working or supporting or reaching and not feeding them, or at that same time through the network articulating and also together with the social development area, we will try to support the people with post collisions that normally was destined for people for floods or natural disasters and more. We there included together with the ministry a area. The state says that they have the obligation to be there and the demand when all the prevention instances failed and the collision happened. And how this presence from the state needs to be, how will we performing this in Argentina? Well, we try to have few windows for support and direct straightforward. We're trying to remove 10 phone numbers, those one where you need to leave your message or generical emails where to send them, and we know that the respond, if they come, will be it will be late, and we hope that, and of course we understand that this don't we need to create a unique platform, a unique straightforward support for all the road safety support. That's why we created the number 164 number. That's the number where you can call 24/7. And on the other hand, you'll find someone that a person, you're not gonna find an email or a voicemail or a AI. No, this network, of course, it's absolutely free. It's fed not only together with the individuals, the calls individuals, but also the transit NGOs that most of the time are the first ones to receive the news from this. They will also go with us and support with us. We are very proud to build this tool that, of course, has a lot to do and it needs to grow and also it needs to be well known because this is a true reality. It's directly proportional the relationship between the how much this it works and how few we know. It does works a lot, and we know a little bit about this. We need to promote this more, and that's why we have this encounter. Without a doubt, will be very useful for us. And you'll ask us why, and if we want to reach the goals that we have aimed, the network has a budget assigned. Of course, it does. With no support, with no funds, well, everything will end up just being a good intention. But we truly know and we understand that there are some countries and there are some states that they don't have, as of right now, the possibility to count with funds for this type of service provides. What I want to say is, and that's if we start of no budget assigning, the support and the fact of just creating a unique channel where we can have the staff member or the state that can know where to go and how to contact that person and guide them in the judicial process, in the health system, it's in the different area, etc., etc. This will be very useful. And if we can't at the beginning, let's try to do it. Let's create a unique victim centers, recognizing them and recognizing their rights and also understanding their obligation and their delegation from the same states of being there in that terrible moment on the life of the people. Thank you very much. We are here, of course, available for the team and charm to add value and to add that highlight that we can all together we can grow in the America and we can grow that commitment, the state commitment with the victims. Thank you very much. Also, thank you, Pablo, because you're sharing us one way or another this successful experience that we have over here in the region and that we hope that eventually this can promote it and it can also well support this capital that we have from the same agency in the areas and that we can also take the successful experience in different contexts where they're necessaries and that we can also we understand that we have some capital in the region to support the countries in and this leadership examples that we had, this also helps us understand that we can move on. And also thank you for your time. We know that your agenda is very you're very booked and it's a privilege for all of us having you down here. Thank you very much, Pablo.
Muchas gracias, Pablo.
Great. Thank you very much, Pablo. Now, then we will jump with the words from Alma Chavez, currently the president of the Victims Against Violence. Go ahead, Alma. Good morning, everybody. Can you hear me?
Sí, te escuchamos.
Yes, we can. It's an honor for me to share with you this space of exchange and dialogue. I think it was founded in 2010 10 organizations of civil society from 13 countries are part of. Our mission is to promote public policies for victim attention and also their family members on a more integrated form. Our goal is to be no victim, so no one can suffer the pain of this situation. We work in the performing Ibero-American meetings and also justice and integrated attention for the road. It's hard that in our region, the collisions are the main causes of population of 5 to 29-year-old citizens. It's painful that in Latin America, 5 million of people are hurt every year. The deaths are painful of more than 142 Latin Americans, Caribbeans annually. The impact, economical and social, it's not, we cannot measure it. The violence represent a big trauma that are suffered by
Es una
of
pandemia.
families worldwide. This is a pandemic that hasn't found the solidarity and the support of the institutions as well. Each number in the statistic represents a life, a story, a loved one. Aside from the statistic, we have the people, which are our family members in our memory. These events are affecting the people. Why? Well, because the people in our region, there is no, still yet, the necessary support. The Ibero-American letter from the rights of all the victims are explaining about the recognition and the support from the victims, not only in the material aspect, but also extending on the moral factor. The road victims, we all have access to justice. We all have the support for the participation in the process. The information, it's important to provide the dignifying support and the access to the victims, the assistance for medical support, and also the protection at the same time for the integrated support. They, the states explain that every individual has the right for life and also the liberty and also the safety in their people. The national organizations recognize that a effective response after a collision will include legal, mental support, all the survivors and their family members as well. The objective number 3 from the Sustainable Development Goals talks about guaranteeing a safe life and also promoting the well-being of everybody in all the ages. The second action for road safety in their Article 5 on the on includes the rehabilitation of all on the damaged people. In the third conference on the road safety factor, we mentioned that it's important we can also include mental health and legal support for all the victims, survivors, and their families as well. From FIGME, we do consider that the role of the associations to establish their synergies with the decision makers. Civil society organized needs to open the road, request the guarantee and the support and the safety of the people, and also support and collaborate with institutions. Road safety needs to be a government priority, and it needs to be we need to implement public policies from the states, listing resources with the goal to fight the road safety and their unacceptable consequences. A couple weeks ago, I was part of the road safety program workshop in Santo Domingo, Dominican Republic. There, we discussed with all the governments so that they can sign a true commitment to create units or for attention or system for them. In another intervention, I will speak and talk about this road safety or workshops promoted by us. I want to thank the Pan American WHO for inviting us and having a more strong agenda to assist the road safety victims. It's an honor for us to share this space together with the parliamentary network of our continent and together with the Global Alliance from the Security. Together, we can also save life. I hope that in the future we won't need to remember each every third November of third week of November are not added. Thank you. Thank you very much, Alma, for your words and also highlighting the important role of civil society in being the voice of all the victims and also the family members of the victims caused by road damage. We also have here Florencia Lamborghini, that she is the coordinator of the Latin American chapter of the Global NGOs for Road Safety. Go ahead, Florencia. Thank you very much, Alessandra. Good morning, everybody. Thank you, OPS, for the invitation, also the great work that's being done. Thank you, Alma, for your words. Always, it's very good and strong, and happy to listen to you, Todd, and thank you for the great work that you're also doing together with your organization in the region. My name is Florencia Lambroschini. I am from the Global Alliance for Road Safety. We have a chapter, a regional chapter, where we focus more on the Americas regions. Our Well, we moved NGOs worldwide. We work collectively with the goal to support vulnerable users and not defend the rights of the victims. As of right now, we have 356 organizations in more than 100 countries worldwide. In Latin America, we have 61 organizations that are part of the alliance and that we all work to protect the rights of all the victims and also protect and at the same time prevent that all this situation won't happen today. What I'd like to mention is to highlight and also include what, as of right now, we have the call to remember all the people that have passed away or that they were harmed by a collision. Recognize the work that are performed by the medical services, recognize the support that from the organization, the civil society, and the international organization to have a quick response for this type of for the strategies, and also call and understand the judicial support that's necessary and that's creating a reference from the director of the Argentinian member that we know that we have in the region. That is why try to create advocacy for more support from the victims together with the attention networks and with everything that can be necessary to move that moment and finally this day on November promote actions based on evidence. On this I want to stop a little bit because from the Global Alliance, we've been promoting this 5 intervention based on evidence. We believe and we know that because we have the evidence to understand that they're effective and that they're reducing the speed and also the organization of the traffic and the laws to promote uh, uh, the protection are very effective and they save life. And at the same time, aside from protecting the vulnerable users, they also have the positive effect of other health problems, such as caused by the same environment. This is something that we've been working since, well, for a while, but we've been working a lot during the World campaign in May because this also represent on reconsidering the how we move, and that's something that's linked from all of these interventions. We believe that with this intervention based on evidence, we have a great opportunity in the region and globally to have a better response for the collisions and prevent them as well. That is why today, Ricardo, at the beginning, he was mentioning the global plan that talk about the safe system, and we're going to be specifically mentioning, talking about the global recommendations that are provided by the global plan about the attention for all the victims and also the post-sinister. This is something that I'll share and at the same time establish a mechanism for all the areas and at the same time something that was discussed in our presentation. This is fundamental for the response against the collision, strengthen the capacities between and among the people that are expert, but they're not medical professions, something that OPS is performing previously, with the goal of strengthening the medical attention as well. Having some investigations, understanding what the root causes of all this damage is fundamental and is something that we face on the challenges in our areas to know more about this. And finally, but is to promote the judicial support in the judicial area those- and the financial inclusive to all the families that see this situation happens. All of these recommendations are performed specifically by the global plan. We believe that in the region we have moved on a lot, but we still have a lot area to cover and a lot of challenges to face. That is why we want to invite that during this month, let's continue supporting and also acting and promoting intervention based on evidence to prevent and also to avoid and have every day less victims. Thank you very much. Thank you very much, Florencia, and thank you very much to all the panelists from this first block, sharing their recommendation and experience to strengthen the post-coalition support. Now, moving on to a more nation focus, I'd like to give the word to Ronaldo Delgadillo, the Director for External Support from the Ministry in Paraguay in the National External Injury Program, all the progress made in their country. So go ahead, Mr. Ronaldo, Dr. Ronaldo. Doctor, I think you're on mute. Quick, I'll try to share my presentation really quick to share my presentation. Are you able to see my presentation? Yes, we can see the presentation. Awesome, perfect, thank you. Before, thank you for the invitation, allowing us to participate in this workshop to talk about this problematic that's not only a national problematic, but also a global problematic. And of course, this is causing a lot of problems in the Americas. Well, the program is just briefly to mention before going to the actions. This constitutes for all of us between the fifth and sixth reason of general death in our country, road safety. This becomes, and this is since 2011, 2012 until right now. And inside the group, as a matter of fact, between 30 and 70 years, like we can see over here in this presentation, it is the fourth root cause of death, but reducing the spectrum between 19 and 39-year-olds is the first cause of death. And due to this, as a matter of fact, the road safety in 2018, there we see, and we continue that it's the sixth reason of death in our country, Paraguay. This is the behavior that we have. In this graph, we can see an item, in the first item about road safety situation, the mortality rate per 100,000 inhabitants, population in 2017, 2018, reaching up to 1 million in the year 2019, X amount of death due to road safety per every 100,000 inhabitants. Something that we are aware, and this is our more recent data that we have on the year 2021. If you can see here, we have reached the sad number of 1,500 deaths per every 100,000 persons. We're trying to understand why in 2020, because Paraguay in 2020 was one of the first countries to close their borders, and we had, like we said before, a martial law, like no one was moving on it during the month of March, April, and May. However, during that same year, the numbers weren't that, they didn't reduce. Yes, there was the numbers were down. However, in the year 2021, we reached the number that I was mentioning before to 1,400. We find with this that during the pandemic, as a variety of situations where the deliveries, for example, the deliveries and also the transportation platforms like Uber, Move, the ones an app involved are the three apps that we use here. Those rice modalities that as of right now, they're still here in the Paraguayan market, and at the same time, they're adding value to the traffic, and at the same time, we're taking some actions to reduce this and control most of the things that has to do with the expedition of the cars and also the driver's license, something that we will be mentioning. Also to consider that Paraguay is and the public attention on behalf of the states, as we can see in the numbers, this is something that we have included more than 80,000 guaranis, more than $12,000 per victim. And here we're not including the expenses from the families, the social expenses that has to do with this type of family expenses as well. Just what the state was spending in each patient. It's interesting to see that half of the budget in health was um, taken from the coalitions. That is why in our country we are always in budget reassignment because we don't have the budget to support all the damage from the collisions. In the next chart, I'd like to share a couple of points that are here. And we have Senadis, where you can visualize. Senadis is the National Secretary of Disabilities. They receive, as of right now, 1 to 4 amputees per day. And they have, as of right now, 91,000 patients that have received rehabilitation process. These are numbers that, of course, are above and beyond of the of the capacities that the country has, and also the reincorporation of the victim in and back to the society, and that they can be useful and that they can be useful, especially to the society as well. We want to mention this graphic because this is something that we've been working on in 2019. As you can see in that graph of 1,200 death back then, together with the 18.5 death per death from OPS. These were a number that they had every 22 per every 100,000. This is a goal that we didn't include them, but in 2011, however, in Paraguay, we did accomplish to reach a stable point on the mortality aspects per collisions. That year, 2022, we were objects of, as a matter of fact, the visit from EXA, which is the System Attention Center from Paraguay. As a matter of fact, here in the picture, this is a picture shared by Ricardo, and this is a document shared and delivered previously to the local authorities in Paraguay. This document was elaborated by an international commission and 19 actors from different areas that interfere, that don't have to do with the post-collision and the activation of the alarm until reaching the urgent centers. We saw 27 recommendations that, as a matter of fact, as are the ones that we are currently working on, because we have guide, a radical guide that's trying to focus our efforts and also transform it and have a positive impact in all of this. As we can see, this is the flowchart that we are talking, we've been working and trying to understand from and understanding the behavior of a collision until the activation of an alarm. We've been facing a lot of problems because we got so many numbers of activating the same system that will end up in duplicating or triplifying the services when the ambulance or the specialized ambulance come, or 2 3 firefighters, or aside from the police. All of this in providing more resources and at, well, probably not only trauma and or other entities that will truly need that unit. So we're trying to filter that process, and during the same process we are trying to filter and we're trying to face some other problems. What I'm trying to explain is that more than 60% of all the victims, we are trying to protect and understand that a victim that has one entity, a potential 60% of them, they're not going alive to all the urgent areas. It is a problematic that we're trying to address from this way. Here we see the pillars of road safety in what we see in the first pillar, but on the second one, there are some things that we need to do with prevention. The other one is limiting us to act as citizens in the roads. If we have identified to modify the laws in action and also identify the permission areas, and now from the upcoming year, we see the alcohol zero, no alcohol, without areas of permission in the behaviors as well. We're also trying to provide the ley SOA. The law SOA is the insurance from the drivers. We know that over here that only 30% of the drivers have insurance. The rest of the people, unfortunately, are what the state can guarantee and what God can provide. All of these factors are also part of they include in the and for the upcoming year, we're trying to elaborate a project with the goal to include the Parliament and in the Senate what the Good Samaritan law is. In Paraguay, we don't have this law that will support the citizens to perform action, will include actions that can save the life of a victim. And this is something that's happening judicially. Pablo, as a matter of fact, that he was, and he used the word before Ricardo, we had the chance to discuss about this in the road safety programs in the parliament, and we launched that in the library, and we are all interested to work together with the region to see a little bit of the legislation, the parallel legislation to support ourselves with this. We're going to try to see and identify the respondent pillar number 5, course, the BEC course, the basic emergency course. We're proud and happy uh, with the attention, the relations that we have with WHO, allowing us the possibility that Paraguay can count with a human material to do all of this workshops, just like Costa Rica performed and did in August. We are currently in the capacity of doing it because as of right now, Paraguay counts with 8 facilitators, temporary and permanent facilitator, and also a master. The person that was trained that as of right now are currently in the master. We can download this course and also train and also potentially the attention from the centers. That is basically what we are trying to use and also looking for all the resources to reduce this on a country level. Something else that we are trying to include on the respond areas, we are we have so many numbers to activate the alarm 132, 139. This is something that we are trying to do a big lobby. We're doing our best to also include this as the 911, the number that's most remember from the population and has a good technology to find a geo reference from the calls and also save a lot of times on our response and location. Among other situations, we're trying to use and also trying to do better in the response and also advise by EXA support. We are accounting together with the registration costs in the system, the medical and hospital system, which is SEM, which is the ambulance, specialized ambulance support adapted for the rescuing of all the victims. Previously, we didn't have a registration victim, and also we had problems with this part. As a matter of fact, with the documentation of all of this, that is why we are trying to implement the pilot programs in the Sentinel programs that are going to be 5 regions in Paraguay to go, as a matter of fact, this same registration at the same time, try to do this unified in all the country because we have so many in the country, different plants with different registration areas within all the entities that are not allowing us to have a clear flow of our country. Something else that I like to mention that's there, as a matter of fact, a product that OPS has available for, which is the SISME 911. This institution, SEME, the one that I'm mentioning, which is the medical emergency system, currently they don't have a system that will collect their data and also include their operation. This is done very poorly in our country, and in this is something that we have as of right now moved technologically. that will resolve truly this type of situation with organisms that can be provided by them. And we're trying to focus on the Paraguay area that we can obtain this service from OPS or WHO. Now, the research, like we mentioned before, we are trying to cover all of this instance, and as of right now, we have 8 facilitators, uh, 2 registered facilitators permanently, and also 1 expert facilitator. With this team from the upcoming year, we'll be able to start the strong train workshops of the rest of the countries to reach the 17 regions, the main regions, especially on the regional office, and they will provide the complexity to guarantee and also the correct reception of all the victims in detention, not only for road safety or collisions, but also traumatological and medical support, because we have to consider that any action that we do over here in increasing the medical attention support on hospital level or extra hospital level will come back in supporting and providing the response worldwide from the emergency countries, medicals, and also traumatological as well. As a matter of fact, here we have some pictures of the back that we performed in Costa Rica back then at the beginning of the year. And the other picture is something that we did on May here in Paraguay. As a matter of fact, the one that we did here, where we trained 30 doctors, nurses, and health members in this, and we selected from this group 8 members that as of right now, they went to Mexico and they count with the certification to be facilitator. Aside from this, we can also work together with ANT, which is the National Transition Area from Paraguay. We work together, we work directly with them, and I understand that since the creation of the agency in 2014 by the law 2016, we have performed different actions in the road safety factor that have contributed not only in reducing the rates, but at least identifying, at least we can control them, that we can, the numbers wouldn't go up. We understand that in Paraguay, for example, in the aims for development, in less than 5 years, we have duplicated the amounts of roads from 11,000 kilometers. Now we got 22,000 kilometers. This means that, of course, having low accessibility for the resources for the population, that there's more speed, and this is included or linked with other situations like using the phone or other safety mechanism that also affect negatively in, as a matter of fact, increasing these numbers, unfortunately. We work with a lot of institutions. This ones that we see here, this is Tircina, focus on youth, on integrated health direction, promoting, as a matter of fact, the awareness, which is something that we are all aiming for in all of this. We have reached in throughout the year training more than 800 people from different institutions, publicly and privately, in the management of the cardiovascular support, because we have found a deficiency in the level of support in the citizenship. The ideal factor would be that two of them, of 3 can know more, because I think in Paraguay the numbers are not how they're supposed to be. As a matter of fact, a citizen, every 5 citizens know about this. 1 out of 5 know about this, and we're trying to work on this. This is a training. This is a training that has to do with the primary attention, so that when an event happens, the team from the victims can also support and assist them with this type of maneuvers, and also provide them a better life quality expectation. These are activities that we're currently performing, and I'd like to mention that during this year, we did launch a numerous of attentions for the victims and the families on the road signature. That's number 189. I heard that in Argentina it's 164. Well, in Paraguay we got this number as well, where we're providing the attention social and juridical, and also in some of the cases, psychological and as well financial of whoever needs it, except the companion, and also the advices that are needed for this first situation that we didn't have in Paraguay. This is something that we're doing and we're trying to work on this aspect. We work closely together with the families and the victims of road safety in all of this type of campaigns that we are doing, because this is what we're looking is that no families can leave something on the table. This is something that we're aiming, we're working, we're doing all of this type of actions. As of right now, we see and we identify the trainings in this hospital system. We are extending the trauma attention center. We only have 4 attention centers in the country. The supervision area, we got 17 departments as of right now. We are potentialing the deliveries. We're opening traumatological specialized attention centers for all of victims. We are waiting up next year so that we can count in a more integrated form and way in the country. This is something that I wanted to share with everybody. These are the things that we are taking and considering between it. Some of them hard to accomplish because this is a government factor and we have to go to parliament, do lobby with the senators that this is something that we need to do, and others that they are very easy and very low cost attention that will create high impact. This is something that we are doing together and how we can keep track of the registration process of all this data that previously we didn't have in the correct time and form to do the actions, implementing the policies to save life and at the same time avoid the sequences. We would like to share that we are currently in the rehabilitation process in Paraguay, but this is something that we are working as of right now through an entity that's ITQ and have a bigger representation to encompass the financial support from the support of this type of sequence that the people might have to include them back in their social reintegration the more complete as possible. This is something that I like to share with everybody, and thank you very much for allowing me to have this space, and we're always open to share and support and collaborate as well. Thank you very much, Dr. Delgadillo, for sharing all the progress in the country, especially on the juridical areas and also the trainings that were performed previously, and sharing the future projects that you might have and promoting the attention for transit in the families as well. Following with our agenda, we now will give the word to Dr. Ignacio Ibarra, Regional Advisor for legislation related to the health of OPS, that will share the legislative initiative on attention and road victim safety and also the parliamentary road in the Americas. Go ahead, Ignacio. Thank you very much. Welcome, everybody. Good morning, everybody. It's a great pleasure to be here with everybody, and of course, thank all the people that have organized this in the OPS, FIGP, and also the global alliances from NGO for the road safety. And well, quickly, I did a presentation to be brief. I think that we have addressed many of the people that were here before, the importance of keeping the legislations, the norms perfectly aligned for with the goal to reach the objective, the central goals that we have, that first of all, we were always considering that life is above everything, so we need to prevent before anything. And it's clear that in road safety, using the correct mechanisms can assist and support the prevention of all the collisions and of course avoid death or any. However, and even though a person can be good or be in a public transportation or driving a particular vehicle, from any type of nature, there are some causes and root causes of that are not uh, considered, that even though there's no type of troll or any type of intention, it's or that they are driving slowly or they didn't drink any alcohol or etc. Well, accidents can happen to other people, and for that, it is important to have a system that can allow us to have a quick response for the effects of avoiding death. And I think there's some very important data available that show us that the biggest amount of deaths are due because of the not an opportune attention to the victims. Just like it was shared by Dr. Delgadillo, it is important to link the parliamentary support for all of this. That is why, together with the WHO, OPS, launched the goal to integrate the parliamentary roads in America for road safety. That, just like it was mentioned by Dr. Delgadillo, it was launched in Paraguay in the year 2018. And this group, 9 countries that launched this originally, and throughout the years, they have been polishing more than at least once. In some years, we have 1 or 2 sessions with the parliamentary, and now the network today has some reps of more than 14 of the countries that speak Spanish. I think and we believe that this work made and performed by the parliamentary uh, unit is important because the national congressmen have that will and that capacity, that multiplying capacity first to promote public policies and make that the public policies can also have a legal recognition. The laws are important as well. In some other countries, these have launched, integrated, and complete. And the recent one, for example, promoting safety mobilities, that it is very interesting. This context is quite interesting. However, there are some specific laws in road safety. However, the legislation, it doesn't go with the specialized laws in road safety. However, this will require a vision and a more complete scheme of all of this. The regulations are basically the road safety, security, all of those norms that provide and reduce the level of alcohol before driving. There are norms that are related to road safety. And well, as of today, we have discussed a lot about the importance of all the health factors related to all of the all of this. This is an important fact associated to the legislation and also the normativity and regulations that, from our humble point of view, it's not necessarily consolidated on the goal of providing a support and permanent support. That is why from OPS, we have been promoting that the countries can work on this thematic, that the parliamentarians can work, that they can build laws, they can also become champions of root causes, and that they can also be close to the people that are the people that vote for them, and that is why they become their representatives facing the National Congress, and that they are all those people that are approving all those budgets, and that they are focusing through the exercise of all the budgets, but at the same time on the public policies associated, they can be important policies by the potential and also the integration that they can have. However, not everything is in the legislation process. They are, this is the same name, this is fixed and explained in Congress. Whoever needs to perform this norm, they need to complement this with rules, with direction, reasons that are technical support areas. They need to act necessary. We discussed this recently about the necessity of the judicial power. I will refer myself a little bit more about this. I want to be brief. We think and we believe that in the Pan American Association, It's important to strengthen all of those schemes, all of those norm schemes associated to the emergency attention and the traumatological support. This is like this because we believe and we think that this shouldn't be integrated. They should be more integrated in the health service area. This is something that we discussed in the radical importance of the emergency factors of the mobile units, of the pre-hospitality support, paramedical support, the first response in the reasons and the cause of the emergency. It's important to define and have understand that even though it's a phenomenal work, like we mentioned this before, we need to still find important factors. Like we said, there's evidence that states that is basically in that area where we see the most amount of deaths that they can easily be prevent if those services could have a high level of service and they could be more efficient and more opportune, that they can have the necessary capacity for all of them. That is why what we see and what we've been promoting is the key development of the infrastructural area. We refer ourselves to infrastructural areas in technologies and support, but especially in about the process. And here I'm talking more about an urgent factor area. But what I'm talking when there's no closed hospital, it's important to value and mention that all the units in any unit can become an urgent matter in the case of that most of the injuries that can be assisted, they can be controlled there, and that they can also include the possibility of being transferred on a unit that with a better resolution. Unfortunately, not all of us live in city where the infrastructure is there, and well, a high number of all the situations are happening in the roads that are basically the roads of communication between the cities, between the villages, between the communities, and sometimes is there where we find um, some necessities of incrementing the capacity of the process, like we mentioned, are important because we have to standardize them from a number, a unique number. The people can look on the effect of supporting the emergency factor. That is the Good Samaritan, not the one that's trying to receive without experience or incapacity some support, but the person that can react immediately. And the immediate reaction is to give and inform the system with the angle to reach all of this objective. Of course, it is clear that a development of capacity is also that all the population can have this skill of providing first aid and also the possibility to have some systems in close areas where recently the roads where the collisions are happening, because this is all measured. This is all analysis of all the less of the injuries and also all the accidents and collision where they can reform this type of measurement. This is something that needs to have a more panoramic view of normative. We believe and we think that especially on the case of all the mobile cases, the ambulance are that they're mobile units, and we have some norms in some countries that are highlighting different type of capacity for the ambulance, but the most important ambulance is the ones that can reach different areas. Sometimes, for example, the most important ambulances, the ones that have bigger resolution capacity, immediate resolution capacity, ambulances that are expensive, but that they can solve some situation. It is important, like we mentioned before, a very center attention areas and all the links of the areas that indeed it's important not only on the urgent factor, but also consider that all the health services are solid, and like the methods that are established by the organization areas, and this is also a norm, a juridical norm. It is important, like we mentioned before, to support the development of the staff, a multiple staff, and also professionalize all the teams that are doing this first reaction. As a matter of fact, in some countries, they request that this staff can be more medical, not most of the time. We can't consider in this situation and behavior because, but it seems like it should be a good tendency, as of right now at least, with the intention also with the radio control. If the peoples are not medicals, but they have the skills, the enough skills to assist in the immediate with protocols very well established, this is another good problem that we have detected together with the normative, because there are some institutions they are not linked, and what I'm meaning is organizations that have urgent factors from military units that are independent from a medical areas. We believe and we think that we have a regulatory framework that's favoring all the attention protocols in those cases. And let's not forget that the health ministries, they're not only health providers, but at the same time, they are the regulatory entities of this type of capacities. And this is something that we need to strengthen on our type of vision.
Hacer
I was mentioning that we need to do some more standardized methods. Those methods are important. For example, in the practical area, in the case of where we open the clinical supporting area, I'll leave you guys thinking 2 seconds, and well, automatically we would think that we need to open the hospitality system, but we should open this from the first response, and how we do that connection between these people that receive the patient as a first contact, and also transfer it and also deliver it. That will be a urgent deliberation space. They can do their pertinent annotate notes about the situation, how all of this was in their context and how was their behavior, and we moved it recently, etc. You are the experts in this, because from this we can determine the immediate reaction that we will wait from an urgent support. This means that probably the attention center will start from the first response and won't finish until we reach the emergency unit. It feels that there's missing a connection, there's a gap between the ambulance that they are able to do the diagnostics fast, quick, straightforward. We've seen this, that probably all this is something that's repeated on the hospital unit. At the end of the day, there are different areas of opportunity that we still, it's important to review from the experts, from you guys that are the experts. We talked about the loss of the Good Samaritan. It's important to understand that these our rules are important, they're radical, because what we need is the guide to that people that have those capacity to assist in urgent matter won't feel intimidated by the consequences that this reaction that they can do can cause the most amount of harm that people might have, and they can review. This is a very important aspect on our juridical area, even though it's a responsibility of the different laws that do respect a different nature. Some of them are addressed on the medical staff that are on the service. Some of them are addressing on the general support. Others have a diverse focus. There's a gap to have a minimum contents of all the elements associated by the Good Samaritan law, and also the problem to save life, the support of saving. Three important aspects on the juridical areas that should and can be part of the legal framework that are in the correct revision, and also the consequence of the collision regarding the reparation of the situation, like we were mentioning before. If a person is on high speed, they have drank alcohol, and that's why they have planetary capacity, or that person have two consequences. One of them is a personal negligence that's having a negative, and that can cause a situation of inadequate situation for all of them, because it can go to jail. They can have a very important sanction due to their negligence. At the same time, they have the duty to fix the mistake. This is something that we've seen that in some of the countries, especially in Central America, they still have some legal frameworks that are excluding the responsibility of the person caused a harm when they were under influence of alcohol. That is why we can't measure the capacity and we won't be able to have the responsibility of our personal case. You probably will understand and will see that um, when we add when someone is drinking and goes in a car, they should be aware of the effect that we can have in their country. It's important to review the context of the penal factors in this matter. That is why it's important, why we need to safeguard the integrity of the people that can be assisted clinically to save their life and also avoid some permanent accidents that can cause disabilities. I think that's one of the biggest opportunities that needs to be reviewed because some of the health systems sometimes they are very limited in the cost, and especially in countries that have high index, and with the goal of reducing and putting, including in the safe market to have all of these areas available in the case of the vehicles, especially in the case of the insurance that it was mentioned in Paraguay, and it's important to rehabilitate them one way or another. We should think and consider in increasing the amount of support that are not associated with the values of all the vehicle. That's why it's important to include some insurance of a car can also increase the capacity of this area when the capacity can also be quite higher. We also think that an area of opportunity could be to work in the revision of the juridical areas related to the health system with the goal that all of this insurance can be efficiently for that goal, which is to guarantee and to make sure that this won't become an additional load for the additional system that of course we all know that they are included. Access to justice says a big reference that one way or another it's important to review and also include them to make sure that the people will stop generating behaviors when they drive and that they can cause a harm. I was mentioning that the not taking care of the amount of the speed, and driving on drugs or on alcohol, we believe that is a very bad behavior and that they can be um, bad in the point of view for our society. The end goal is to prevent. That is why we see that there is a space of opportunity as well, the legislation in with the goal of promoting a more safe system in the reality, and at the same time there from there we won't have the necessity of of acting on those type of situation of transit, or well, those situations won't happen. And well, of course we still have a very important scheme to reach that that can have a commercial impact important, especially on the moment of including juridical norms, the usage, and also the mandates of using those mechanisms that can make the video or have the area. All of this is an integrated area on the can be useful to include. I appreciate the support and the time for allowing me to express
Muchas
myself.
gracias,
Thank you
Ignacio.
very much, Ignacio,
Muchas
for your
gracias por la
intervention.
información.
Very important, valuable information that has been provided.
Ahora,
Now,
nuevamente
once
le doy la
again, I'll
palabra
give
a
the
Alma
word
Chávez, la
to
presidenta
Alma
de
Chavez, the
FICMI,
president of
quien
FIGMI,
nos hablará
that
sobre
will
liderazgo
share
social
the
en ámbitos
integrated
de
attention
gobierno de
for the
emergencia.
victims,
Adelante,
after the
Alma.
emergency. Good morning, everybody. Good morning, everybody. Once again, I sent a spreadsheet if you can share it. But before this, I'd like to do a reflection of everything that I've heard from the people that were here before. The prevention is definitely a topic that we do need to make visible in all of our governments in our Latin American region. In Latin America, we try to stop the fires due to the consequences of, which is at the end of the day more expensive. That's why our countries we are so poor, and also at the same time the pain from the families after a collision. This is how much is the what is the price of a life? We can't give a price for that. what my dear colleague Nancy was mentioned, the parliamentary factor of doing a reference of the mobility law and safety law in Mexico, for example, was promoted by the civil society organization. We're united together in a big alliance called Safety Mobility. We are more than 100 organizations distributed throughout the country, 32 states, 32 Mexicos, because we have different, very, we have a lot of difference between the north, center, and the south and the west. However, we all work together when the same voice. No more road test. This law explains about the safe framework. We don't want to focus more on the infrastructure part, which of course in our country is very deficient, and like the rest of the countries in our region, they're not safe. This is something that we do need to work together in future legislations. And also the end users of the road. In fact, the law talks about the law of mobility, which means that every one of us, doesn't matter how we decide to move, we will reach and we will go to our places safe and sound. Right now, we are currently in a harmonization process. This has been very difficult. We have already published the strategy and we're working on the system as of right now. Unfortunately, we couldn't be able to have in this legislation an agency that could be. However, the force of the same civil society will give us some, the reduction of death in my country, in Mexico, as of right now. 44 people will die today, for example, in roads and in avenues. And also talk about the justice factor, which is very painful in our country because we do consider homicide as um as death. We need to we need to work a lot on the penal code and also on, well, today we have to talk about the integrated areas. Share and mention that in the areas of Argentina, and we have already have an agreement, and with this we could strengthen this federation law. In Colombia, for example, we have the Orbi Center that depends on the digital factor, on the mobility of Bogota. And today we're working on an agreement with Sabaneta, working on a municipal and a city level. In Costa Rica, we have the attention support of victims that depend on the public ministry. And of course, the judicial support that will recommend and also include the physical area and assistant included inside the protection system or the victims attention center. In Chile, the Foundation Amelia that's part of FICPI, the areas of support and free areas. We have an agreement together with the Attention Center from Subsecretariat Prevention of Crime. In Spain, we also is member of FICPI, account with the National Office for the Victims, multidisciplinary, and also this all the necessities of the victims in the character implemented by the Justice Ministry. We're also missing and working in many of the countries in Latin America, and we also have an agreement together that we're working together with the Dominican Republic, with Intran. We are discussing this so that we can have a better support or a unit for the road attention, effective road attention. And in Paraguay, also we have the representative in Paraguay, UNICEF, is committed to accelerate the process for the implementation of all the attention units. This is something that we have in an agreement between all of the countries. Well, the units of attention basically, or the attention that we are trying to promote, is that all of the victims could have the social attention, the juridical attention, also psychological attention. We understand that, for example, in the psychological area, no one is prepared to receive this type of collisions. That is why we have here the prevention of the double victimization. We have to identify the psychological assistance for a previous support. We need to provide an attention on site for psychological attention. We have to go back on the health system areas and the victims that are requiring a treatment in a short-term period need to give emotional support and also, if possible, in our countries generate or promote the union of all the victims in that network of victims so necessary that are supporting the victims in healing their healing sooner. We need to do it in a companion during that space and take care of the communication and emotion. We're also interested in promoting justice and to all the victims. We need to assign the victims legal advisor that at the end of the day can also could take care of the victims and on other victims. We need to remember that the justice needs to be, take care of the victim and also prevent it for the society and re-educate it for the culpable. In the juridical area, we request that all the professional can have empathy and could respond the answer of the victims in a more comprehensive areas. We need to understand that all the information that's provided to the victim needs to be real and rigorous because the victims in all this process, we need to have all the information available. We need to orientate the victims as well in their legal process about the claims, about the process, and also about the follow-up. We also need to identify some protection mechanisms according to the different groups of crime and also identify the accompanying the victim in different type of pro, uh, paperwork. In the social area, because we need to understand that in our countries with so much poverty, this leaves a lot of complications in economical level. In my country, for example, the victims have an impact in the internal product about 23%. I feel that is a very similar situation in all of our region. We need to have a special attention to the people that are having a economical vulnerable situation. We need to provide response to the necessary response. We need to orientate with the possibility of having economical resources together with social programs that all of the countries can have. We need to orientate these victims in the process and also the requirement for the level of disabilities and resources to rehabilitation process as well. And well, we recommend the governments that they create or that they can adapt integrated level units for the families that they can promote the specialized units that can harmonize the different frameworks of the security, orienting the level of criteria and response. We understand that this is very hard. We understand that Latin America is late compared to other regions in the world. But we understand that if we don't visualize the victims and we don't generate a public policy for their attention, it will be very hard for all of us, the emotional recuperation and also impact for the social textile. That is why we request the decision makers that are with us today and the rest of the organization, the civil society that are here with us, the alliance, we do have synergies so that the victims won't be re-victimized and they'll be living hell after a situation like this one, and that the family members can be assisted like they're supposed to because it's part of the human rights, universal human right. On my end, it's basically it. I'm not sure if there's any other question or any other observation. We are here to assist you and support you. Thank you.
Muchas gracias, Alma, por
Thank you very much, Alma,
la presentación.
for the presentation. And also,
Quisiera mencionarles
I'd like to
que
mention
tenemos la
that we
grabación de
have
la sesión
this
en
session in
YouTube,
Spanish and in
donde
English
podrán
available, and you will be
ver
able
las
to see
explicaciones
this in
con
this
el enlace.
upcoming link that we will be
Tenemos
sharing.
por medio
You'll have
de la
access
página de YouTube
to
de
the
PAHO y
YouTube
también por la
channel and
plataforma
also
que creamos para
on the web
servidores.
page that we created for this event as well.
Antes de concluir con
Before
nuestra sesión,
concluding this
queremos
session,
expresar nuestro
we would like
agradecimiento
to
por su
thank
participación e
everyone
interés
for your
en el seminario
participation and your
alrededor
interest in this
del
virtual
Día
workshop,
Mundial de Recuerdo de las
uh,
Víctimas Viales.
remembering all the victims.
Voy a dar la palabra
We want to give the
al
word
doctor
to
Ricardo Pérez
Dr.
Núñez
Ricardo
para
Perez
concluir
Núñez
con unas
so
palabras
that he can
finales
give us a
y después
closing words and
continuamos
also
con la
we
sesión.
can conclude with the session. Also, we want just to thank Alma and Florencia, to all my colleagues that presented from civil society, that for all of us it's a fountain of motivation about the importance of continue being more effective in the work that we're performing from the Pan American institution with the support of all the countries. We also had the great chance and opportunity to see important factors of the work that we are promoting in the region on the perspective of the attention, emergency factors, and also on the perspective for the victims once the emergency happened, and also the inspiring story of the national institution of the road safety in Argentina, and also important elements that are being promoted, decided since the Ministry of Health from Paraguay, and also other good examples in the region that eventually will learn. And we believe that all of this good experience on how we have accomplished on working, that some of them are still integrated in the publication that we are sharing today. We put the link on the chat box, and others are going to be shared on different areas. But eventually, all of this work together definitely gives and promotes that there's a chance to continue moving on in this topic. And eventually, if we do this together, we'll be able to move on together and more smooth. I want to insist in that part. We also had the chance of receiving and also from our local expert Ignacio Ibarra, some situations to consider in terms of the juridical area and how we can incorporate the juridical area in promoting how we're promoting this post collision situation. All of these are elements that are looking and promoting and stimulating the work in on the region context, on those ones that are more needed, and also thank everybody for your participation. We believe that um, more than one that's listening today, is participating today in this virtual workshop, will have the chance tomorrow on presenting, introducing something of the work that they're doing in this type of spaces. We believe that this is something that this has to be a continuous process, and also more on a regional aspect, with the pro of receiving, understanding the commitments that, of course, UN together with WHO, we have put ourselves in the goal in reducing the death and also the injuries. We appreciate this chance and opportunity of reflecting with everybody. We want to thank the local authorities that are with us, and also our colleagues of Camino, and on this road safety situation that we have faced in many, many ways. And we hope we can continue add value and being more effective for everybody. We want to thank you, and thank you for being with us today.
Muchas gracias, Ricardo,
Thank
por
you
la
very much, Ricardo.
presentación
Well,
de
we
este
hope that
trabajo
this
tan
event would be
importante
very informative and motivating,
de
and that we
investigadoras y
could
otros
take very
participantes
valuable ideas
en
to
este
strengthen the
país.
post in your
Si
countries.
no hay
If
ninguna
there is
otra
no
pregunta o
other question
comentario,
or comment,
cerramos
we will
esta
close
sesión.
this session, this
Gracias a
event.
todos
Thank
por
you
su
very much, everybody, for
que tengan un
participating.
bonito
Have
día.
a great day.
Muchas gracias.
Gracias a todos por permitirnos compartir experiencia.